Tumor lysis syndrome is a complication that can occur between 12 and 72 hours after chemotherapy. Chemo happens to kill good cells as well as bad cells. In order to understand tumor lysis syndrome, you have to understand what's inside your cell. We have potassium, uric acid, and phosphate inside our cells. Chemotherapy is killing a lot of these cells. So if we break up this cell, we have a lot of release of potassium, which leads to muscle weakness, cardiac abnormalities, so look for dysrhythmias. You have a release of uric acid. Think of gout. How do you treat gout? Well, you give colchicine, you can give raspbericase, or you can give allopurinol. The release of phosphate, high levels of phosphate bring down calcium. So we're gonna have hypocalcemia, hyperphosphatemia, hyperuricemia, and hyperkalemia. You know how to treat those things. High potassium means cardiac monitor. We treat it with dextrose, insulin, calcium gluconate, KXLate, and sodium bicarb. Hyperuricemia, you treat with raspbericase, allopurinol, or colchicine. Hyperphosphatemia, we treat with calcium. If your patient does develop acute kidney injury, the treatment may be dialysis. Low levels of calcium means that we lack sedation in the brain, so those nerves are firing rapidly, so your patient needs to be put on seizure precautions. As always, follow for more and let me know in the comments what you'd like to see next. Tumor lysis syndrome is an oncological emergency. So if you see it on the NCLEX, that should raise major red flags for you. You need to understand that because calcium is going to be low, you want to monitor for positive Vostick sign, positive Trousseau sign, as well as airway compromise. Because calcium is a sedative or a relaxant as an electrolyte, it can cause spasms of your bronchial or laryngeal muscles. So always assess for your airway. Because this patient has hyperkalemia, you're putting them on a cardiac monitor and might even need to do an EKG because this patient's now at risk for VFib. So understand that if the patient goes into VFib, you're going to do your ACLS algorithm. Shock, shock, epi-shock, amiodarone, or lidocaine. This helps you remember your ACLS steps to take. We always do shock, we shock again and give epi, then we shock and give amio or lidocaine. I also want you to remember that because this patient has high levels of uric acid, it is a very, very important intervention for you to do strict I's and O's as well as daily weights and monitor their urine output. We aggressively treat with IV fluids to help flush out all of these extra electrolytes and toxins. This also puts the patient at risk for acute kidney injury or nephropathy. So make sure you understand number one is IV fluids or hydration, your cardiac monitor, lowering that potassium with the medications we talked about earlier, giving calcium, and lowering that uric acid level. Let me know in the comments if this helps.